This is Retirement News Online. For those that retire before age 65 and are eligible for Medicare, finding affordable health insurance can be challenging. One solution that can cost less is called a short-term medical plan. My guest is Tyler Meek with Drew Capital Group in Tampa, Florida. So Tyler, why is it so difficult to find affordable health insurance for this age group?
So yeah, Scott, the cost of health insurance and healthcare in today's day and age really is skyrocketing, and one of the main reasons being Obamacare and the Affordable Care Act. A lot of people had the misconception that it was going to be affordable, but unfortunately it's not. And the reason being is because the ACA, or Affordable Care Act, simply forced all of the insurance carriers to take on everyone. They're guaranteed issue, meaning that it doesn't matter whether you have a clean bill of health or whether you're sick, that insurance company is forced to take you on. And because of that, it's a lot like being thrown into a risk pool for car insurance. You're helping to pick up the costs of other people, and it results in significantly higher insurance premiums.
So what do you tell your clients in this situation?
What we're really starting to see with our clients, especially as they're getting closer to that retirement age, and if they do retire prior to 65, that Medicare age, a lot of times what's happening is they're having to pull from their investments. They're having to take distributions, but at the same time as when they're doing so, that fixed cost of healthcare doesn't change. And like anything else, as you get older, unfortunately, it doesn't get any cheaper. It gets more expensive. So what we try to do is give our clients some options to help supplement that extra cost. And what we've found is we can do so by looking into what are called short-term medical plans.
Finally, explain how these short-term medical plans work.
These short-term medical plans are really interesting, and they're quite simple, to be honest. So essentially what they do is they go back to the way that the health insurance market used to be. There's medical underwriting involved with these plans. And when I say underwriting, I'm not talking like that of a life insurance policy where you have to schedule a paramed or have blood work or physical or any sort of exams done. The underwriting is anywhere from 7 to about 15 or 20 yes or no questions, depending on the type of policy in which you're looking at. But these questions screen the potential insured for any major pre-existing conditions or illnesses. Those conditions including cancer, HIV, AIDS, things like that. Because the company is able to conduct this screening, this underwriting, they are able to weed out people who are unhealthy and normally wouldn't qualify. This essentially results in significantly lower cost of insurance, significantly lower premiums. Normally what we see, almost cutting premiums in half. So they essentially reward you for being healthy. Unfortunately, with that being said, not everyone is going to qualify. But that's where we unfortunately sometimes have to revert back to those ACA plans. If you do not qualify for a short-term plan, we can look into other options in terms of ACA and Obamacare type plans.
That's Tyler Meek with Drew Capital Group in Tampa, Florida, and this is Retirement News Online. Thank you for watching.